Ladies and gentlemen, my name is Alex Matthews, and I'm going to present a change in practice that we hope will have far-reaching effects on the provision of outpatient lumbar microdiscectomies in the region, particularly during the COVID-19 pandemic. The British Association of Day Surgery has highlighted the importance of increasing the adoption of daycase lumbar discectomy. Outpatient lumbar discectomy can provide improved patient satisfaction, lower complication rates, and lower costs, particularly during the COVID-19 pandemic, where the number of inpatient beds may be limited. The model hospital identified Derriford as a national outlier in the provision of lumbar decompressions as day surgery. Currently, only 25% of lumbar decompressions are performed as day surgery. We implemented a change to service, converting an entire surgeon's cohort of patients undergoing a microdiscectomy to daycase, in line with national recommendations. This study aimed to assess the patient satisfaction with the daycase service, to ensure this quality improvement was appropriate for the patients, and whether there is a scope to improve things further. In order to change practice, we implemented a new protocol which involved patient and staff education to change the stigma associated with spinal surgery and suggest daycase spine should be routine, production of a daycase suitability checklist produced by Dr. Mary Stoker from Torbay Hospital, where emphasis was placed on appropriateness of home setup and support rather than patient age and comorbidities. Production of a single daycase booklet, amalgamating and improving on several booklets already in existence. And in conjunction with our anaesthetic colleagues, we developed a standardised anaesthetic and surgical protocol aiming to reduce post-operative opioid exposure. Patients were also given a standardised TTO medication bundle based on their pre-operative morphine requirements. A retrospective single surgeon cohort review identified 23 patients who were listed for day surgery microdiscectomy. 5 of these patients were converted to inpatient stays due to either cranial or spinal trauma impacting on the list start time. 17 out of 18 patients were available for telephone clinic follow-up, where a standardised set of questions were asked by a single interviewer. This slide summarises the demographics of our cohort and shows a low complication rate. All patients were satisfied with their experience, and 94% were happy with the appropriateness of the information they were given. A similar number were pleased with the physiotherapy advice they received and felt safe for same-day discharge. However, we did observe a relatively high number of patients who were dissatisfied with their post-operative analgesia. Furthermore, a descriptive analysis of patient comments identified a small group that reported difficulty with opioid withdrawal following their operation and would have preferred written advice on this. We present a standardised infrastructure which has enabled our unit to successfully perform more daycase lumbar decompressions with high patient satisfaction. We also highlighted the importance of planning theatre lists, with a daycase discectomy as the golden case. We will be using the outcome of this retrospective study to feed back to all members involved and review the suggested improvements. We will amend our analgesia TTO bundle in line with patient feedback. We will commence automated and standardised text-to-website satisfaction and outcome score collection for live prospective data collection in the future. We will also encourage wider use of daycase spinal surgery within the Derriford neurosurgical department. And we will also explore the option of daycase spinal surgery outside of Derriford within the Southwest region. Thank you very much for your time. I will now take any questions.